Figures seen by the BBC have shown a dramatic rise in the number of children in the UK being prescribed antidepressants. An international study has revealed a 54% increase in the use of drugs in those years between 2005 and 2012.
And the UK's 4 children's commissioners say that psychological therapy should always be tried before doctors resort to medication and have called for waiting lists to be shortened. Howell Griffiths starts his report by talking to Sarah Dale, who's 22.
It just seemed just more medication. That'll make you better, but it clearly wasn't.
Every day since the age of 16, antidepressants have been a constant in Sarah's life, but 6 years of medication have brought consequences.
My short-term memory was shattered. I have a whiteboard on the back of my door which I have to write everything I have to do each day.
Now aged 22, she works with other young people battling depression. She's concerned there are many more children growing up without the right sort of help.
It seems to be doled out to me like Smarties by doctors. I think it's just a quick fix thing to keep young people safe whilst they're waiting for therapy such as CBT or psychological therapies.
In 2004, antidepressant use amongst children fell after concerns they could lead to suicidal behaviour. But research for the European Journal of Neuropsychopharmacology shows use then rose over the 7 years that followed. The UK's 4 children's commissioners say they're worried what might be behind the trend.
What we do know is that there are very long waiting lists for psychological therapies in many parts of the UK. And so what a concern would be is whether this rise in antidepressants is being used really as a shorthand to treat children and young people for depression.
The clinical guidelines on using antidepressants with children here in the UK are clear. They shouldn't be offered initially when the symptoms are mild. In more serious cases, they should only be used alongside psychological therapies. While each doctor is free to prescribe what they think works best, the guidelines say there are some drugs that shouldn't be used with children. But the research shows in most cases doctors are prescribing other antidepressants. The Royal College of General Practitioners says that family doctors are sticking to the guidelines, but it recognises there's a growth in children seeking help. For some, the real concern is that relatively little is known about the impact of antidepressants on the developing brain. The difficulties of testing with children leave too many unknowns.
My concern is that antidepressants were developed for use in adults. So using them in children, I think, has unpredictable effects given how much change is going on in the brain and the fact that it hasn't fully developed and new connections are being made or pruned all the time.
For Sarah, writing has been a way of expressing how antidepressants made her feel, but she fears too many other young patients are being left without a voice. Howell Griffiths, BBC News.
Let's get the news, the travel and the weather.